Okay, so this cute little guy over here, who just is absolutely adorable, this is Romeo. Hi. Romeo's quite sick. Romeo's got quite bad anemia, which means he has a shortage of red blood cells. So he's struggling to get oxygen to all his tissues, which is essentially what the purpose of blood is to carry oxygen to all the tissues in our body. So in his nose, we've got a little nasal cannula that's attached. Oh, Chizoo. It's attached to this tube that's attached to this machine, which is making oxygen. So we're delivering extra oxygen to him to help him because he's got anemia. And also what we really want to show you in the video today is that he's actually receiving a blood transfusion. So if you look here, this nice red tube is actually full of life-giving blood, because he needs blood in order to feel better, to oxygenate his tissues better, and to allow us some time for the medication that he needs to correct his anemia to take effect. And we needed to take this blood from a donor dog, and we did that today because we're here in Dubai, and we are not fortunate enough to have a blood bank. Like in a lot of other countries in the world, they'll have a blood bank that veterinarians can actually get donor blood products from. So we have to get donors, which are usually either staff members' dogs or members of the public dogs that are prepared to allow their dogs to be donors. These dogs are specifically typed. There's a certain blood type in dogs that allows them to be a universal donor. And this dog was typed, and he's given us blood, and this blood is now going to Romeo. Now, Romeo has to be monitored carefully. You can see I've got a couple of things here. Basically, this is just a little pad that's telling me every few minutes I need to check his heart rate, need to check his respiration, need to check his blood pressure, need to make sure that he's not having a reaction to the transfusion. Because the transfusion is obviously a natural product from another animal, and it is possible that his body can decide it doesn't like it and can have a really nasty immune reaction that in severe cases can be fatal if they're not addressed. So in the beginning stages of a transfusion, we have to carefully watch the blood go in, watch him for any changes that may indicate that he's not tolerating the blood well. Sometimes we have to stop the transfusion altogether. Other times we can just slow it and administer medications. It all just depends on the situation. But so far, Romeo's being a little champion. He's sitting here like a good boy, getting his oxygen, getting his blood. And we're pretty sure that he's going to be feeling much, much better when 200 mils of that stuff has gone in.